All right. So my name is Lara Canham, and I'm a faculty member here at the University of Colorado PT program, and I am the coordinator of the Recruitment and Admissions Committee. I'm also a graduate of the program. So I graduated in 2011, and I've been working in the sports medicine realm ever since. I still treat patients clinically, so about 2 days a week I'm in clinic, and the other days here at campus. Um, I'll have Natalie introduce herself as well.
Well, hi, everyone. I'm Natalie Palmer. I'm one of the admissions team here at the University of Colorado for our PT program. I grew up in Colorado. I have a background in higher education and healthcare informatics in both large metropolitan areas and rural locations. And I'm glad to be here today. I'm glad to see you here too.
So we'll move through section by section, and at the end of each one, feel free to ask questions. You can either unmute yourself or you can type in the chat. If you have questions as we go, Natalie will be monitoring the chat as I speak and vice versa. So feel free to ask along the way. So without further ado, I want to tell you a little bit more about the University of Colorado. So we have 4 campuses. One is in Boulder, that's our main campus in Boulder, University of Colorado in Denver. We have our Anschutz Medical Campus where Natalie and I are housed, and then our Colorado Springs campus. And so again, 4 campuses under one university. Today we're going to talk about 2 of them, the Anschutz Medical Campus and our Colorado Springs campus, because you have 2 pathways to consider when you think about our program. We have a residential campus here in Aurora at the Anschutz Medical Campus, and we have our hybrid campus at Colorado Springs. So it's the same program, same curriculum, same degree. It's just the educational mode is different, whether you're in person or education via a hybrid experience. Again, same curriculum, but we do have parallel resources amongst the 2 campuses. So we have, our simulation learning on 2 campuses, interprofessional education on both campuses, laboratories and cadaver facilities available at both, and our lecture halls on both the Anschutz campus and our Hibble Center at UCCS. So I cannot say enough that this is the same program, same curriculum, same degree, but we do have 2 educational pathways, and we're going to talk a lot about each of them as we go through the presentation today. So while I will cover a lot, we do have even more on our FAQ page. If you utilize this link here, it should take you right to it, where some of the common questions you'll find, some have the same answer, again, because the program is the same, and some answers differ a little bit based on the residential versus hybrid mode of learning. And so that is broken out on our FAQ page. If you want to refer to that at any time through your exploration of PT programs, please do so. So the curriculum, again, for both pathways is a 2.5-year curriculum. We start in the summer. So you'll see here we have summer 1, and then it's 2.5 years full time. So each summer, fall, and spring semester for 2.5 years. So you would begin in June, and then you would graduate in the December, 2.5 years later. You'll note here a couple things. And by the way, this is on our website. So if you need to reference this, it's a little bit small. It's a busy slide. This is on our website. You can find the full curricular mapping there, as well as some course descriptions. But what I do want to point out is in particular the green blocks. Those are actually our clinical education experiences. So you'll see that they fall early and often. We have our students in clinic as early as the first fall. And in fact, it's about the 3rd week of the first fall that students are in clinic. And so as you're thinking about PT programs, I want you to think about when those clinical experiences happen. So some programs do all the didactic work at the beginning, and they save all their clinical experiences to the end. Others, it's all based on philosophy, like ourselves, like to have it spread throughout. And so as you're looking at different PT programs, this might be something you consider as what might suit you the best. I'll talk a little bit more about the clinical education component here in a second. The next thing I wanted to talk about as it relates to the curriculum is some programs have a required research component and others do not. We are a program that, while we have an abundance of research opportunities for our students, we do not require it. And so our program has a bit more of a clinical focus, whereas others may have a bit more of a research focus. So again, as you're looking at other programs to apply to, this might be something that you explore. Is there a required research component? Is that something I want? Or is that something that I might want and have the opportunity to explore, but might not be required? Again, our program has an abundance of research. Many of our students get involved, but it's because they want to, not because they are required to do so. Our curriculum covers a wide scope of practice, orthopedic, medical, neurologic conditions. We are equipped to prepare you to be a generalist physical therapist upon graduation, meaning that you can serve any patient and any population, any disease, disorder, or diagnosis at any age. So again, a wide breadth of experiences. So I've already spoken a little bit about the clinical education being one of our unique aspects, the fact that it's early and often. One of our other unique aspects is our interprofessional education. And the reason this is so special is because our Anschutz Medical Campus is that. It's a medical campus. So the other disciplines here with us are the medical program, the PA, pharmacy, nursing, dental. We have the ability just on this campus to have research. We have 4 hospitals, our university inpatient and outpatient hospital, the VA, and Children's Hospital. So all on this campus, we have a robust interprofessional sort of experience, and we do incorporate that into our curriculum. Our students actually have a course that is integrated with the other disciplines. So they would be assigned a group of students. Maybe they're one of several PTs of a group of also medical students, dental, pharmacy, PA, nursing, who talk about ethical scenarios, patient case scenarios, and they learn about each other's scope of practice. So this is intertwined within our curriculum, and it's really unique because we are this medical campus. So a lot of PT programs may not be housed on a medical campus. They might be on a more traditional undergraduate campus or separate. And so again, as you're thinking about other programs to apply to, this is one that is really unique to us, is such a robust interprofessional education. And while this is housed at Anschutz, students who participate in our hybrid pathway at UCCS in Colorado Springs have the ability to participate in this remotely. So they are just as involved in the interprofessional education as our residential students are. Back to clinical education. I mentioned that the first experience is in your first fall, and that's what we call ICE. It's a collaborative experience. So you would be in groups, usually about 4 students in a group, and it'd be local. So for those that are in our residential pathway at the Anschutz Medical Campus, your clinical placement would be in the Denver metro area. And for those who would be in our hybrid pathway, their ICE experience would be during at one of their immersion times, where students all come to Colorado Springs for an immersion. Part of their week would be in lab, learning their hands-on skills, and part of the week would be in clinic in the Colorado Springs area. Then in year 1, we have our first independent clinical experience. So that's 8 weeks in the first spring. Then we have a second collaborative experience, followed by a second independent experience in year 2. And then in year 3, our final culmination of our clinical education. So I'm going to break out each of these a little more specifically. I've already spoken a little bit about ICE, so integrated clinical experience. We have 2 of them, one in the first fall, one in the second fall. I mentioned that it'll be local, either in the Denver metro area or in Colorado Springs, and those are assigned since there's group experiences. So 4 to 5 students, it's collaborative. The students absolutely love it because they can really work with each other. They can utilize each other's skills and strong suits. They can observe each other. They can collaborate. And so this is a really unique opportunity for the students to practice what they learned over the first summer and the first few weeks of fall and immediately put it to practice. They sort of remember, why they applied to PT school, why they're working so hard, because they get that patient care piece of it. When the students are in their independent experiences, those could be in-state or out of state. We have sites all across the country, including Hawaii and Alaska. And we do not have international sites, however. We often get that question. Really, the reason being is our program is required to prepare you to be licensed within the United States. And so our clinical experiences need to be within the United States. Any global experiences would be something that you could pursue on your own, maybe post-graduation. But really, as it comes to your official clinical education, that would be all within the United States. For the first experience, you would be working with your clinical education advisor. So every student is given a clinic advisor, and you would work with them based on your prior experience, maybe your observation, maybe your work experience, maybe some research experience, and maybe some personal interest to sort of begin to map out what your clinical experiences would look like from beginning to end. And so that conversation starts early, and that first rotation, so CE1, you'll more or less be placed somewhere. So this is maybe the one where you have the least amount of say, but this is all in light of a larger conversation about your overall path throughout school. In CE2, which happens in your second year, you have a little bit more say. There's a lottery system. So you'll be given an entire list of all the available sites. You get to rank order your top 10 choices. And then at the end of that ranking, there's a lottery system and students are placed accordingly within that lottery. And so you have a little bit more say of where you're going because you get to rank order those. The final experience, you have the most say. You have an application and an interview. So you would write a cover letter, you'd submit your resume, you would apply to the sites that you're interested in, you would interview, and then you would essentially be matched to that final rotation. Some students choose to do what we call a post-graduation internship. So this would be students going to the same location where they were just at for their final rotation, so 16 weeks is CE3. They would graduate, take their board exam, and then they would return to the same location for 8 more months. So they would have 4 months pre-graduation, 8 months post-graduation to make up an entire year at this location. The post-graduation experience is a paid experience. Now, however, this is usually a reduced salary because these clinics are guaranteeing mentorship time. And so they may have a reduction in your caseload. They may have mandatory time throughout the week for mentorship meetings. So therefore, there is a bit of a reduction in salary. Currently, a small portion of our students complete this, about 10 to 20% of our students. And our CE team is constantly working to either acquire sites or maintain the sites that we have. That is for all of these rotations, CE 1, 2, 3, and our ICE experiences. I want to go back to the sort of who might choose doing a post-graduation internship versus, excuse me, just doing the CE3. So again, everybody completes 16 weeks. They would graduate, take their board exam, but some people choose to go on and seek employment on their own. And then others may choose to do this internship. And the reasons vary. Some people want that mentorship. They're scared about that first job. They want guaranteed to have mentorship. They want to have that job. So they apply only maybe for those internships. Other students maybe choose based on location. We have a few people joining us from Texas today. So maybe that person wants to return to Texas. And so they apply and interview for sites that would be in a location where they want to be. Others might choose sites based on the setting. So let's say you're interested in pediatrics. So you choose and apply to all the pediatric sites. Maybe some of them are CE3 only, some of them are year-long internships. And so they may apply and interview for both, given that they just want any opportunity to be in a pediatric setting. So our students really vary on how they choose whether or not they want to pursue this. And again, a small portion of our cohort each year does complete that internship. We do require that one clinical experience must be completed in a rural or underserved community. And so for those that are in the Denver metro area at the Anschutz campus, if you're unwilling to go to a rural community, say rural Colorado, because of maybe a commitment to be in the Denver metro area, maybe there's family that you need to remain close to, we would place you in an underserved community for your requirement. But many of our students do choose to take opportunity to have an experience in a rural community. And our hybrid pathway, we really do require that that is a commitment to have one of your rotations in a rural community. We also require that you have at least one inpatient and one outpatient experience so that you have a breadth of experience through your clinical experiences. Again, upon graduation, we want you to have a breadth of experiences and to have the ability to treat any patient that comes your way. And so we cannot have you have all of your experiences in the same setting. And so those are a few additional thoughts around clinical education. I'll pause here. Are there any questions as it relates to the curriculum and maybe clinical education specifically? Go ahead.
Yeah, hi. So I'm looking at, a couple programs. I'm not really sure where I want to apply to and where I want to put most of my eggs and, those kind of baskets. How similar are these curriculums based on different kind of programs?
That's a great question. So really, There's some similarities, meaning that we all are required to teach the same content. But in terms of time, some programs are 2 years, some are 3. Some, again, have this clinical focus, some have a research focus. Some put all the didactic early, the clinicals at the end. What I really recommend is that you go to the websites of a lot of the programs that you're looking at and really see if they give details about what it looks like and if they have a map such as what we have when it comes to their curriculum. Some programs too might call courses differently or have a different flow. So for example, we have our musculoskeletal unit broken out of 4 different semesters. MSK 1, 2, 3, and 4, whereas another program might integrate that a little bit differently. And so I hate to say that the work does fall a little bit to you as an applicant to go to these websites to look through. But the biggest things that you might start with are some questions around, how long is the program? What does a typical semester look like in terms of course load? When are those clinical experiences, and so on and so forth? Good question. Okay.
I have a
Go
quick
ahead.
question really
Yeah, go
quickly.
ahead.
So how do you determine which students get to go to the hybrid campus and which students are going to be in person?
It's a great question. So we will discuss a little bit more in the application piece, but you get to choose. So our application will be one application, and within that application, you can say, I'm only interested in residential, I'm only interested in hybrid, or I prefer one, but I'm open to the other. And we have sort of both scenarios. I prefer hybrid, I'm open to residential, and vice versa. But you within one application get to tell us that. And we will ask you usually at 3 different time points, your initial application, right before interviews, and then right after interviews to see if you've changed your mind. But really, we're putting a lot of it on you to decide, how am I going to learn best? Do I know that I could be an excellent hybrid learner? I do well on my own. I can, self schedule my time. I can be attentive even when I'm alone in my room. I love the idea of a lab immersion. If that excites you, great. But if you're like, no, I need to get up and go somewhere every day, I need to be in a classroom, I will excel if I have other people next to me when I'm learning and lecture, then you know that residential is best for you. So we're really looking for applicants to do a self-assessment on which pathway is the best for them in terms of an educational method. Go ahead. I see a question, a hand up.
Hi, Laura. Quick question about the curriculum. Are business classes incorporated about starting your own practice?
That's a great question. So because not many people actually do that in terms of the entire population of physical therapists across the country, it's proportional in our curriculum. So we do have requirements from our accrediting body to do some business content, but we're not required to teach you how to open your own practice. We do have a lot of extracurricular things, like we have a private practice special interest group where they bring in business owners to come speak about their experiences, but those are usually over lunch hours or in the evening. It's not within the formal curriculum. So we try and give people the opportunity if they want to seek it out, but again, it may not be within the formal curriculum itself.
Okay, I had one more question too. I saw up at Anschutz you're under physical medicine and rehabilitation. Is there an opportunity, if it becomes interesting, to switch from the physical therapy program into the MD program of physical medicine and rehabilitation?
It's a great question. So yeah, just to provide some clarity, we are within the School of Medicine, and within the School of Medicine, there's the Physical Medicine and Rehabilitation Department, and the PT program sits within that department. And the answer really is no. If you wanted to switch, you would have to reapply completely for the medical program and then pursue that path. We do have some collaboration with some of the physicians and physiatrists, but that is purely on more of a sort of within some of the classes or labs. But if that's a direction that you decide to take, it would be switching completely and reapplying.
Okay, and what is the primary difference between the two in your mind being established in the program? Between the physical therapist and the physiat?
Yeah, so the biggest difference being that someone who's becoming a physiatrist or a specialist in physical medicine has gone all the way through medical school, and they are maybe someone who is seeking to treat pain in a non-operative way. So that might be via medications, injections, other means, whereas a physical therapist is really seeking to optimize movement. We're prescribing exercise. We are optimizing how somebody is moving about the world. So physical medicine rehabilitation often has more of a pain focus, whereas physical therapy often includes pain, but is a larger sort of pain, movement focus in terms of the practice.
So, in an institution like Stedman Hawkins, would a physical therapist be taking direction from a doctor of physical medicine, or would they be working on their own to create the program?
So within the state of Colorado, in most states, we have what's called direct practice or direct access, meaning that the physical therapists are the doctor and get to choose the plan of care. There's not a prescription of a doctor necessary, but there certainly would be collaboration. So the physical therapist would have their own ability to create that plan of care, and then again, work collaboratively if they need to in a larger institution such as Stedman Hawkins.
Okay,
So,
thank you.
yeah.
Laura, one final question before you
Yes.
move forward. Jose is asking in the chat, does CU have a network of out-of-state sites for clinical ed to get started for students, or is it the student's responsibility to find their own out-of-state site for a clinical education?
Good question. So what sites we have available right now are sites all across the country that we have worked hard for years to establish positive relationships with. So some of these sites, they might be all across the country, have taken our students, for the last 20 years, possibly the last 10 years, the last 5 years. Our job is to really find sites that we believe are good educational experiences, that they work well with our students. They show that they take our students year after year. They follow along with our curriculum. They, collaborate well with our program. So we have a lot of sites already in place. We do have some students that may come in and say, can I start my own site? And really, that's a lot of work if you imagine creating a contract, finding the right site, making sure it's up to our standards. And so our team will often look at it and see if it's feasible. Sometimes that does happen. In fact, with our hybrid pathway students, one of our goals is to keep our students in their home community. So if you know that you want to live in, Jose, I forget where you're from, but I'm going to make up Minnesota, let's say, and you know that you want to serve your home community, we would do what we can to try and help keep you there if you're part of our hybrid pathway. That's one of our missions specific to that pathway. When it comes to our residential pathway, we're really looking for students to utilize some of our already existing sites. And again, a lot of those are very strong. We've worked with for years for those out of states, but this is our clinical education team. You don't need to set that up. Your focus is on school, and we'll communicate with you about your desires when it comes to clinical education, but our team will be who sets up those sites and helps figure out these rotations. All right. Moving onward, I want to talk a little bit about student life. So I'm going to start first with our Anschutz pathway, our residential pathway. So I mentioned our campus, a really robust medical campus. We have educational buildings where you'd be walking down the hallway seeing dental students and medical students. We have 2 PT labs, though, that are specifically our space, and we have what's called simulcast capability. So in this bottom left picture, you can see our lab, and you can see we've got television and projector screens that's showing what's happening at the front of the room. So you might be in the back of the room, and you can look up on the camera and see zoomed in what the instructor's doing. You might be in our second lab, which is in the door, next door, watching what's happening on screen. So we have the ability to run 2 labs at once, have video and audio within both labs. Both labs, the students can ask questions, so they can, and we can call on students from each lab. So we have video happening both ways. And so this just about allows more students to be in the lab at the same time, a greater student to teaching assistant ratio because we have TAs, lab assistants walking around in both labs, and the ability to have that hands-on experience, usually just with 2 people per table. So one person's playing PT, one person is playing patient while they're practicing these skills. We also have anatomy cadaver labs in some beautiful space, top floor, beautiful windows and skylights. So just a really special place to honor our cadavers that are helping our students learn. We have 2 semesters of clinical anatomy. So this is a picture of our lab and one of our lecture halls on the Anschutz campus. Our students love to come, especially lunch break. So from 12 to 1, most of our students can be found out on the quad playing spike ball, volleyball. It's usually sort of their time to decompress because classes happen kind of like a full-time job. You can expect to be in class from 8 to 5, Monday through Friday. Some days you might start late, so maybe you don't come in until 10, or maybe you end early at 3. Maybe you only come in for an exam that day, and then you're done for the rest of the day or have the day off. So most students can expect about 25 to 30 hours of class time a week, but we really tell students expect it to be full-time, Monday through Friday, and that you have not only the class time, but study time in the evenings and weekends as well. Classes are typically in 2-hour chunks, so a 10-minute break in between, and then a 10-minute break sort of as a passing period before your next class. And labs can be anywhere from 2 to 4 hours long for our Anschutz students. When it comes to housing, our students aren't able to live on campus technically. However, right behind the parking lot, there are 2 apartment complexes, one called Fitzsimmons 21 and one called the Fremont that's within walking distance. We're talking a 5-minute walk behind the parking lot on campus. So technically it's off campus. However, many of our students do live there. They like that proximity. There's 1, 2, and 3-bedroom apartments at these complexes. And so some of our students live with other PT students, some live with other students of other disciplines, so maybe a nursing student or pharmacy student. Many students prefer to live off campus, so maybe they bike to campus. We also have a light rail and bus routes that come directly to campus, so maybe you live within public transportation, and others, again, just depending on their needs, live throughout the Denver metro area. We do have Facebook groups and our campus student service to help find roommates and housing. So once you're accepted into the program, we have a Facebook group that allows you to meet each other and say, hey, who's looking for housing? Anyone want a roommate? Where are you moving from? So on and so forth. So we try and help out and facilitate as much as possible. Aurora is about 10 minutes east of the downtown Denver, and about 30 minutes from the foothills, so the closest hiking and biking. It's about an hour and a half from the closest ski area. So many of our students really take advantage of, the city of Denver, as well as the recreational activities throughout, within very close driving distance. As far as student life at UCCS, this looks different because classes are held virtually. So you will, though, be expected to have weekly live times. What I mean by live is what we're doing right now. You'll be expected to be in front of the computer, on Zoom, camera on, participating, usually daily at some point, maybe a couple hours a day, maybe just an hour a day, but at some point each week there is live class time. So you still should be expected to be available during that normal work week. It just might look a little bit different. Maybe you only have to be on camera for an hour, and then the rest of the day is asynchronous, where you're maybe watching video modules, reading material, doing small group discussions that you coordinate on your own. And so it just looks a little bit different in terms of the structure of how you are live, when you're live, so on and so forth. All students that participate in our hybrid pathway would be required to attend about 2 on-campus lab immersions per semester. And those are usually anywhere from 5 to 10 days in duration, so 1 to 2 weeks. When you come for a lab immersion, if you don't already live in the Denver or Colorado Springs area, you would be responsible for your own travel and your own housing accommodations. So many of our students typically do like an Airbnb all together. They get a big house that they share, or maybe they are couch surfing of the students that do live at UCCS as a means to for housing for these lab immersions. Our Hibble Center, where our PT labs are held, is this beautiful facility you see here. It is also a functional health science sports medicine center. So we've got physicians, exercise physiologists, and PTs that work for Centura that work out of this building. It's also housing the nutrition, exercise physiology, nursing department at UCCS. So this building alone is very interprofessional and collaborative. We have PT space and cadaver lab space there. And then same as far as finding housing, coordinating specific needs. We have a Facebook group and campus services for our hybrid students as well. So this is what maybe a typical semester would look like. So maybe your first 5 weeks are all remote, and then maybe week 6 is when you come to UCCS for your first immersion. And then you go back home, you have 4 more weeks of virtual learning, and then maybe finals week, you come back for another lab immersion and some final exams. So this is a summer semester, 11-week semester, what an immersion schedule might typically look like. As far as Colorado Springs, I'm going to turn it to Natalie, who is our Colorado Springs expert here to tell you a little bit more about the community there.
Thanks, Laura. I grew up in Colorado Springs. I live here in Aurora near the residential campus, but I was down on Sunday visiting my folks who live not too far away from campus. So Colorado Springs is a great city, blue skies that you can see in all of those pictures. And I'd say there are 3 main things that have influenced Colorado Springs. One is the outdoors. In that upper left-hand corner, you can see Garden of the Gods, which is a public park about 15-minute drive away from the UCCS campus. You also have this beautiful view of Pikes Peak anytime you're there, and you are only a short drive away from national forests, places to hike and bike and all of those things that you may enjoy. The second is the Olympics. On the upper right-hand picture, that's a picture of the Olympic Training Center. And so this is where our Olympians and Paralympians often come to train. You will see them out and about in the community, and you may even see some of them engaging in research and other things going on at the Hibble Center. And finally, the military is a really large part of the history of Colorado Springs. The bottom picture there is the United States Air Force Academy. There's also places like NORAD, Peterson Field, Fort Carson. So a large military presence has definitely influenced the development of Colorado Springs. It's a great place, great restaurants, great shopping, a great place to go spend a week or to move. Thanks, Laura.
Thanks, Natalie. All right, so I have mentioned a few times that being a student in any PT program, not just ours, is a full-time job. And we often get the question, can I work while I'm in school? So we have found some of our residential students have found some flexible positions. They work maybe 6 to 10 hours a week. So what I mean by flexible is that maybe they work here on campus at the library, at the circulation desk, where they're able to study and work after, that 5 p.m. date. Some maybe work as Uber or Lyft drivers, or maybe as a nanny. Maybe they work at a coffee shop on Saturdays and Sundays only. So they are needing, again, to work around that typical Monday to Friday 8 to 5 time slot in order to find that flexibility. And while the hybrid pathway may allow for a little more flexibility during the week, like I said, that live time every day potentially is required. But while you might have a little bit more of an ability to flex your schedule, we're really recommending that working more than about 15 hours is a huge challenge. We really want to stress that you should be a full-time student first. There is no part-time option, so you can't pick or choose what classes you take and when. You saw our curriculum. You take the same classes, the same semester as everybody else. We call that a cohort curriculum, meaning that you and your classmates are traveling through the same classes each semester so that you graduate that 2.5 years later. What questions do you have about either pathway and sort of that day in the life of a student? Yes, go ahead. You see a hand up.
Is there a point in the program where you'd be certified at the level of maybe a PT assistant to be able to work on weekends?
If you were to be a physical therapy assistant, that is a separate educational requirement and a separate licensure. So we have had PTA students apply to our program prior, but they already have the PTA. So there's no point within the program where after certain semesters, you are a PTA. That's, again, a separate curriculum, a separate licensure. You would sit for a separate test within the state with which you hope to practice. And so we really are expecting that our students are coming in, are fulfilling that full 2.5 years to finish with a doctoral degree.
Okay, thank you.
Mm-hmm. All right, so now on to a few of the things that our program in particular values. So again, as you're looking at other programs, I really encourage you to go to their website, see what they talk about in terms of what they value, the things that they require and don't require, like research or service learning or volunteerism. So we don't require any type of volunteerism or service learning, but we have an abundance of opportunity, and it's something that we really do value. So we find that our students and our faculty often take part in this significantly because they care about serving our community. So here's some examples of what I mean by that. We have something called the Stout Street Clinic, which is a monthly clinic where we don't have class on Friday afternoons so that our students can go to Stout Street and they treat patients who are homeless. This is in downtown Denver. The students and some faculty preceptors work together collectively to treat our homeless population. We also have the Dawn Clinic that's here on campus at the Anschutz campus to serve our Aurora community. These are especially patients who are either homeless or uninsured. And so these individuals can come to campus. This is an interprofessional clinic. And so they might come in and have a initial evaluation by several student providers. So maybe a team of maybe a medical student, pharmacy, nursing, and PT student collectively examine someone and they determine, does this person need blood work or imaging? Do they need an assistive device, medications, a sling, braces? What do any sort of needs that they may have? And if they are deemed appropriate for physical therapy, they would come back on a separate night that's a PT only night where we have patients scheduled for a full hour. They would have a team of 2 PT students and a faculty preceptor go through full evaluations and treatment sessions with them. And so most patients are seen anywhere from 3 to 5 visits. So this is a progressive and continual care. It's not just a one-time, here's my recommendations and move on. This is really a sustained effort, again, for patients who are homeless or uninsured. It's specific to our Aurora community. Rusty gloves is what you see in this upper right photo. It's a renaming of punching for Parkinson's. So Parkinson's disease is a progressive neurologic disorder. Unfortunately, it's something that does not have a cure to it, but we do know that high intensity exercise can slow the disease progression. And so all over the country has popped up these high intensity exercise classes for patients with Parkinson's, and we call that Rusty Gloves. So we actually have a few sites throughout Denver, Boulder, and Colorado Springs that our students participate in. They absolutely love it, and the patients really appreciate the time in a group exercise environment as well. We have something which we call outreach, which I don't love the name, but this is the best we have to call it. What we mean by outreach is that we're trying to reach out to any middle schoolers, high schoolers, people who wouldn't know what PT is otherwise, to let them know that PT could be a career for them. So maybe we're going to a middle school, talking to a group of 6th graders about what PTs do and doing some interactive experiences. We have that both here in Aurora and Colorado Springs, throughout the state where we reach out to our rural communities, but we're really trying to help people who would maybe not know of PT otherwise learn about it as a potential profession. And so much more. We have a picture here of a group of students and faculty who went to the state capitol. This was just about a week ago, this picture is from, to advocate for PT services within state legislative events. So, letting patients and their providers and our legislators know that PT is a treatment for pain, that we should be advocating for our patients, choose PT over opioids, for example. And so our students, anything that was potentially related to physical therapy practice, this is what our students and faculty went to the Capitol to speak on behalf of just last week. Now, UCCS is currently working to build their own opportunities. This is a new pathway for us. We had our inaugural cohort start just this last May, and they're working to develop some more service learning opportunities in Colorado Springs. I do know that because UCCS is also an undergraduate campus, our students can participate in any of the sort of clubs and initiatives down there on campus anyways. And so some of our students help. There's something similar to our Rusty Gloves for patients with multiple sclerosis. And so some of our students have begun to participate in that. So UCCS will have its own opportunities as well. One of our other sort of values and goals is our commitment to diverse representation and inclusive excellence. So we want our students to feel like they're part of a community, a sense of belonging, support, and value. What I mean by that is we are working hard to recruit and retain students, faculty, and staff from all over the country, all means of life. We want to support career development. We want to foster respectful discourse, prepare students to be leaders for practicing in diverse communities and healthcare settings. We have research agendas that are focused on this. Our quality of education is enhanced because of this value. We are working hard to have partnerships within our community, not just what I've told you about with our Stout Street Clinic and Dawn Clinic, but clinicians, clinics, and resources all over the Colorado region in terms of our partnerships and our clinical education across the country. And then hoping that all of this culminates in improved healthcare utilization, quality for our patients. And so this is something that we really value and believe in. So I'll pause here to see if there's any specific questions about some of our particular program values, such as our service learning and other commitments. So I see a question in the chat. Oh, maybe that's
I was going to
Natalie.
say a great question from Jose. Laura, you listed these volunteer experiences that they can participate in as a student. Can they participate in these if they are not a student with us?
A great question. Some of them possibly yes, some of them I know no, and some of it is because of just some liability. So for example, our students at the Dawn and Stout Street clinics are covered under the professional liability of our program. So we require you to be a student in that case to fall under that umbrella of liability. As far as the Rusty Gloves and some of the services for exercise groups for multiple sclerosis, I think some of those can be maybe searched. Again, they are all over the country. They might be at other undergrad institutions. So I think some of these opportunities might be possible ahead of time. But again, the ones that are specific to our program and campus, unfortunately, no, because of that umbrella of needing to be a student within our program. All right. So on to some really important stuff, and then I will hand it to Natalie to talk about the application process. But without further ado, I really do need to talk about tuition and financial information. As you're looking at other programs, this should be a large factor that you consider. So our tuition is based on whether or not you're in state or out of state. We do, as a Colorado program, have a really unique opportunity to allow our students to pay in-state tuition after they've been a resident for 1 year. This is really special. Not many programs across the country allow you to become an in-state student. And so in terms of a financial standpoint, this is very helpful to a lot of our applicants and students. So if you're out of state and you move to Colorado, a year after you move, you are eligible to be in-state. And so a lot of our students may move right before they start in June. So let's say they move in April or May. Exactly a year later, they would be able to pay in-state tuition. So they would pay out of state that first year and then in-state tuition for years 2 and that half year of 3. The 4 things that are typically required are that you have a permanent Colorado address, you register your vehicle if you have one, you get a driver's license in Colorado, and you register to vote. After those 4 things are accomplished, our Office of Residency will give you a date in which you became a resident, and a year after that date is when you can be eligible for in-state tuition. Our tuition is based on credit hour. You can see here that we have 46 credits in year 1, 48 year 2, and 22 in year 3. So this next slide is a little busy. I want you to hang with me. This is all of the numbers for in-state and out-of-state, and I'm going to break it out into each one. So based on the 628 and the 1315, we'll just say as of spring of 2025, the total tuition costs on the right-hand column. If you're an in-state student, we're looking at just under $73,000. Out of state, again, this is assuming that you move after your first year. So this could be someone who's a residential student that moves to the Denver metro area, or this could be a hybrid student who decides that they'd like to live close to Colorado Springs and for the sake of ease of travel for immersions and whatnot, they might move and establish residency. So we're looking at 104,450. And then if you are a hybrid pathway student and you choose to live out of state the entire duration of the program, it is about 152,540. Now, I'm sure all of you are looking at this and saying, well, why wouldn't you move? Many people have different situations. So on our FAQ page, on our website, we actually made a PDF of 4 different scenarios of why you might choose one over the other based on your personal circumstance. So let's say you are out of state, but maybe you have a free place to live. So your cost of living, your travel expenses are very low. You would only need to maybe travel for your immersions. You might actually find the out-of-state option more affordable than moving and doing sort of this option of establishing residency. So I encourage, if you're in this position where you're not quite sure, like I'm interested in hybrid, I'm not quite sure what to do or what my scenario is or my cost of living, or even choosing between CU and other programs around the country when you think of tuition. I encourage you to go to our frequently asked question or FAQ page on our website, look at these scenarios, see how we tried to figure out the total cost for 2.5 years. Again, we included like where would the cost of a 1-bedroom apartment in Denver versus living somewhere else. These are things to consider as you're looking at different PT programs. Now, we were ranked, according to US News and World Report, as number 11. And so what we decided to do is look at the top 20 programs at their tuition cost. Now, this includes fees, but as a high-ranked program, so being number 11 in the country out of over 300 and some PT programs, we're really proud that not only are we high-ranked, but we are one of the more affordable amongst the top 20. So this is for in-state tuition. This is if you're a Colorado resident for the entire 2.5 years. If you're out of state and you establish tuition after that first year, this is what the difference amongst the top 20 programs looks like. So again, we're really proud that we're a high-ranked program, but we also are of high value. We will do what we can to keep costs down. We know that student debt is a significant issue. And so we're doing the best we can in terms of keeping ourselves at the bottom part of this picture. Now, unfortunately, I don't have a graphic similar for the hybrid pathway. What I can tell you anecdotally is that we fall right in sort of the mix of a competitive tuition for hybrid pathways. If you're thinking about hybrid and you're looking at other programs around the country, do look at their financial structures. Some of them, like ours, is the same cost as their residential pathway. Some of it is a completely different tuition structure. So make sure you're looking and comparing totals when you're thinking about both. As far as what else to think about, tuition's not it, right? What about the cost to apply? Natalie's going to tell you a little bit more about the details there. What if you have to travel for an interview? If a place requires an in-person interview, to fly, maybe stay in a hotel. What about relocating if you're going to move states to whatever program you choose? What about the living expenses in the state or city that you plan to live in? So these are things to consider as you're looking at other programs. Now, what about after you graduate? Let's talk about salaries, because I want to be really realistic as to what you'll face when you graduate. A lot of people assume, well, I'm going to be a doctor, and therefore I will have X amount of salary. Well, that very much differs based on 3 things. One of it being where you live. The second, well, on the next slide, is the setting in which you work. And then the third is how many years of practice you have. So first, we'll start with where you live. You can see here that it vastly differs based on which state you live in and what, in terms of what your salary is. The problem here is that some of the places that are the highest salaries are also the highest cost of living. So if you look, for example, at the New England region or in California or Washington, they're very high cost of living places. Yes, they are paid more, but that cost of living is different. And same for some of the places that maybe aren't paid as well. Well, they might have the lower cost of living, in which case that might be more appealing to you. As far as practice settings, the most recent data I have is from 2021, and you can see here 9 different practice settings, and they vastly differ. So for example, right in the middle is a skilled nursing facility. That is very different than the one at the bottom, which is a K through 12 school system. Now there's some hidden things here. So for example, if you work at a K through 12 school system, you might have summers off, right? Because you work at a traditional school system with a traditional school calendar. So if you have 3 months off in the summer, you might say that's worth being paid a little bit less because of that vacation time. So again, just as you're thinking about practice upon graduation, the setting in which you practice matters. Now, this is an average amongst all employed PTs. This is not just new graduates. So I assure you that as a new graduate, what your entry-level salary is probably $15,000 to $20,000 less than what you see here. So for example, in the Denver metro area, a private outpatient group, we're seeing students starting anywhere from $65,000 to $70,000, which again is about $15,000 less than what you're seeing on this slide. Now, As far as how to help pay for PT school, we do offer scholarships in 2023, and I can confirm for 2024, we had over $260,000 in scholarship, and that's up from just $1,000 in 2011. That's remarkable that in just about 12 years, we've grown that much, and we're continuing to work on growing. We have both current and prospective student scholarships with particular focus on some of the things that we value, such as that inclusive excellence, as well as serving our rural community. So our students actually apply for their scholarships. Should you be invited to interview, you would be invited to apply for a scholarship. That would be an essay that would be read by our scholarship committee, scored, and then determined through our scholarship committee. So that is separate from the admissions committee itself. And then our current student scholarships would be the same. About a year later, you would be informed of some scholarships. You would apply, write essays, sometimes interview, and then our scholarship committee would determine. We do also recommend you look outside of the programs for scholarships. There's all sorts of institutions that offer scholarships for future PT students, future healthcare students, you name it. I encourage you to really look and spend time, not just before you start school, but even while you're in school, about helping supplement the cost of your education through scholarships. There are some financial resources you have available to you now. You do not need to wait till you're a student. So our American Physical Therapy Association, that's our national association, has a financial solutions center that you can access as a prospective student. Probably the best resource I've seen is this financial aid FAQ for prospective students. That's part of this ACAPT. That's our academic PT entity. So if you just Google financial aid FAQ prospective student, you should find this ACAPT website. And then just because you're not a student at CU yet does not mean you can't contact our financial aid office. So feel free to Google student financial aid at University of Colorado and see if you can find someone to speak with there to answer your questions. So again, you do not need to be a PT student to start to ask questions about your financial future. So what questions do you have regarding tuition, scholarships, and salaries, the financial pictures? All right, without further ado, I'm going to turn it to Natalie to talk about admissions.
All right, great. Well, the first thing I wanted to do before I really get into the meat of things is I wanted to let you know that you are warmly invited to join us for PT Preview Day, which is on this coming April 5th, a little less than a month from now, actually. We have two sessions, both on the same day. In the morning, we'll be on the Aurora campus and at the Anschutz campus. From 8:30 to 10:30, we'll have an information session, and then there will be a campus tour. Once that session finishes, all of the staff is going to up and drive to Colorado Springs, and we'll be having a session at the Hibble Center at UCCS. Now, the information session that will be from 2 to 4 p.m. Is going to be exactly the same content as what will be covered in the morning session. And then there'll be a tour of the Hibble Center from 4 to 5 that afternoon. I'm putting the link for registration in the chat right there. So that is the Qualtrics link that I put right there. There's no cost to attend. You can attend one, you can attend both. We will also be having those information sessions. You will be able to join by Zoom. A lot is similar to what is going to be covered to here with some additional speakers and content. But if you would like to join, we would be happy to have you join us when we have that event coming up on April 5th. All right. So as we move forward, let's talk about the application process with a great picture of our last week. Our hybrid students were on campus, and there they are in the Hibble Center in that picture right there. So how can you apply for our program? Well, to be eligible to have your application reviewed, you need to have a bachelor's degree in any field prior to matriculation. And matriculation is just the word for enrolling and starting in our program. So you can have a degree in process while you apply. It just needs to be completed before the program starts in May. You need to have completed all the prerequisite coursework. You need to have a minimum cumulative GPA of 3.0. That's based on all previous course attempts. There's no course forgiveness or grade replacement. And if you are a foreign language applicant, you need to have an appropriate score on the TOEFL or IELTS to demonstrate English proficiency. Now, the GRE is not currently required, and I will be talking more about the GRE coming up in a few slides here. So that competitive GRE, that competitive GPA, what does that look like? Well, for our incoming classes, our last class of 2026, the average GPA was a 3.63 and the science GPA was a 3.49. So we have folks that fell above that and folks that came in below that. We're really interested in seeing strong grades in certain courses like your anatomy, physiology, upper division sciences, exercise physiology, and biomechanics. We're interested to see that you are ready to take on doctoral coursework. So let's talk a little bit more about that GPA. If you have a GPA that falls between 2.7 to 2.99, you may still be eligible for application review. We recognize there are a lot of different paths to higher education, and sometimes people had a family circumstances or a difficult time adjusting to the college environment, and we're looking for academic growth. So if your GPA falls between that 2.7 to 2.99, you may be eligible if your last 60 credits of coursework is a 3.5 or higher. Now that QR code on your screen right there, that will take you to the PTA or the PTCAS GPA calculator. It is a spreadsheet that you can download, read all of their instructions. You can put in your coursework, especially if you've attended 2 or more schools, and this will give you an opportunity to see how your GPA will be calculated inside the PTCAS system. So what is the prerequisite coursework for CU? Now remember, prerequisites are going to be similar for PT schools, but they will not be the same. So please research each school that you are planning to apply to carefully. We require a full year sequence of general or college chemistry 1 or 2, and a full year sequence of general or college physics 1 and 2. And both of those need to include a lab. So it may have been part of the class or it may have been a separate lab, but lab-based chemistry and physics. A 3-semester credit statistics course, 2 psychology courses. Now, most anything from a psychology department will work, but if you're not quite sure what to take, we would recommend developmental and or abnormal psychology, great content to apply to your future career. And you also need an English composition or writing course, which is 3 semester credits. We have 2 groups of classes, or 3 specific classes, I should say, that you need to have completed within 10 years of matriculation. So if you are planning to apply and put your application in this summer semester, or in this coming summer, you would need to have taken these classes in the summer semester of 2016 or more recently for these classes to be considered as prerequisites for you. And that would be human anatomy with lab and human physiology with lab. Now, some schools offer those as standalone separate credits, and some offer those as an anatomy and physiology 1, anatomy and physiology 2. We will accept either sequence. We would also highly recommend you take those at the upper division at the 300 or 400 level if possible, just to help you be best prepared for the curriculum when you arrive. We also require an upper division science credit. This will be anything from biology, chemistry, physics, or engineering at the 300 or 400 level or above. But we will also accept exercise physiology or biomechanics, and those could be taken at the upper or lower division, upper division if possible. We need a total of 3 semester credits to meet this upper division science. And that exercise phys or biomechanics is just a recognition that not all schools offer that at the upper division. If you have a case-specific question that you would like to ask us about, please email us at the PT admissions inbox, and we'll put up that email link at the end of our session. So with that prerequisite coursework, When you are applying, you can have coursework planned and in progress during the application system or application year, but you can have no more than one outstanding science prerequisite course in progress the spring semester prior to matriculation. So, for example, our students that will be starting in May, we could have someone who still needs to take Physics 2, but they would not be able to take Physics 2 and exercise physiology during this semester. Everything else will need to have been completed by December prior to matriculation. If you received a C- or below in any of those prerequisites, the course would need to be retaken for a grade of C or higher. And we do accept AP or IB credit. If it is accepted by your undergraduate institution and listed as a specific course credit on your transcript, that should be fine. However, we may ask you to contact College Board and get a score report if there are any questions. Some of you were in school during COVID, during those COVID semesters, and may have been at a school where they awarded pass-fail grades during those semesters. We will accept pass-fail grades from what we identify as the peak COVID semesters, and that is spring, summer, or fall semesters of 2020. Outside of those semesters, if there was an option for letter grades or a pass fail in a course, then we would require that you selected the letter grade for your grading. So let's talk about the GRE for a minute here. So this coming application cycle, we do not currently require the GRE, and that is not going to be a part of our admissions process in this upcoming year. However, we want you as prospective applicants to be aware that the role of the GRE within admissions is an ongoing conversation for not only our program, but a lot of programs around the country. And we just want to make you aware that the GRE could be required as soon as the following year, 2026 to 2027. So let's talk a little bit about the GRE. And the things that we'd like you to know about the GRE, first of all, is that it is a valid assessment tool. We know that research has indicated, this is how we know it, that a high GRE score correlates with success on the NPTE, which is the required exam that all students have to take when they finish the PT program before they can be licensed in any US state or territory as a physical therapist. This makes it a really valuable indicator of your potential performance in PT school and beyond. And given the significant time and financial investment required for a DPT program, taking the GRE now, despite the cost and time to prepare, could help you determine whether you are academically and test ready before making the commitment to attend graduate school. Now, as we click forward on these boxes here, as you can see, it is an indicator of success on the NPTE. We recognize that a lot of universities have been test optional for several years. And so there is a possibility that you may not have experience taking a standardized exam, or it may be 4 or more years since you have sat down to take a standardized exam. And the GRE is an opportunity to practice critical test taking skills that will be essential for that NPTE when you finish school. We recommend taking it at a testing center if you can, rather than at home, because the NPTE is always administered in a testing environment. And this can really help you identify any weaknesses in test taking, anxiety that could make a difference in your long-term success. Now, while we acknowledge the value of standardized test scores, our admissions process is holistic, meaning we evaluate applicants based on a broad range of factors beyond just grades and test scores. We consider your academic performance, your leadership, your service, and other personal attributes that align with the profession of physical therapy. And I'm going to talk a little bit more about that holistic review process coming up in a future slide. Okay. So if you have questions about prerequisites, about our policies, if we have a change to our GRE standards, Places you can go for accurate information are the first places we would start would be on our CU website. We update that on a regular basis, as well as the PT CAS directory. We have to submit that information, and we make sure we have internal consistency between the PT CAS directory and our CU website. So you can always go to those places for sources of truth for things like important dates, prerequisites, and contact information for our program. Do you have any questions about the content that I have covered so far? Okay, not seeing any hands. Let's talk about that holistic review process. So we look at many different aspects of your application when you are considering being a part of our program. I'm going to talk about all of these in the future slides, and you'll notice that I have put a link in the chat to our application page, which includes prerequisites, timelines, and more. So first of all, yes, we do look at grades when we look at your academic history. We're interested in the rigor of your courses. Have you taken multiple upper division science courses? Did you challenge yourself? Did you perform well? We're also interested if you have any master's degrees. Have you done research? Have you worked as a TA or as a tutor? These are all things that are considered competitive within our process. We're looking for that positive grade trend that I talked about earlier. Did you grow academically during your time as a student? There is a question, an essay question in the PT CAS application that says, does your GPA accurately reflect your academic capabilities? Please take the time to answer that if there is something to your academic journey that you would like us to know. People sometimes ask, what are the things that I should do to get into PT school? And the answer for us is we're looking for you to be engaged in activities that are authentically engaging, meaningful, and purposeful to you. And we'd like to know more about those. So for example, have you sought out service opportunities? How did you help others? How did being involved in that activity impact their community? And how did being involved in that community change or impact you and your view of the world, or help you build new skills? We're interested, did you pursue leadership roles? These could be formal or informal leadership roles. Were you an officer within a club or in an organization? Have you been a manager at a restaurant or a shift lead at a retail store? Have you led or planned large events? These are all things, working with other people, communication, problem solving, that are a part of the modern healthcare field. And so we're interested to know more about your experiences and how you're going to bring those forward into the physical therapy profession. We'd also like to read your essays, and we will, in fact, read all of your essays. We'd like you to include your personal experience and self-reflection. Think for yourself about how you can stand out to your reviewer and find a good proofreader, someone who is not afraid to pull out a red pen and let you know how to make your words even stronger. You may have a writing center at your institution. You may have, if you've graduated, there may be alumni services. You may have a friend who's an English teacher, someone who's going to be able to give you some really good feedback. As well, the expectation is that these essays are written in your words. Please do not use the words of others. Please do not use AI. We're looking for an authentic you to be brought forward into the process. Observation hours. This is another area where you're going to find some differences between PT programs. Now, some schools require a certain number of observation hours. We do not require observation hours, but we will consider them as a part of your application portfolio. PT school is a huge investment of time, energy, and financial resources, and we want to make sure that you are aware of the profession you're going into and you have done the discernment to recognize that this is the best place for you to be moving forward. We want you to learn about the profession and share with us how and what you've learned. And there are a lot of ways to learn about it. That could include observing PTs in a variety of settings, inpatient, outpatient, those are all places, home health, different places you can observe those. You can do informational interviews, talk to a PT. How did you decide? What's your favorite part? What's the challenging part? How do you learn more about research? And all these kinds of conversations you can have. The APTA website has some fantastic information for people considering a career in physical therapy. You can listen to podcasts. There are several and more popping up all the time about physical therapy. And you can also observe and interview other healthcare providers. How did you determine that you want to be a PT and not an OT or a speech therapist or a medical student? It's important that you take the time to make sure you have the right answers, and we'd be interested in hearing about those. We also require letters of recommendation. We require at least 2 letters, and we will accept up to 3 letters from people who know you well. We do not accept letters from family, friends, or clergy, but it's a wide range of who we will accept letters from outside of that. Most commonly, we do receive letters from professors, supervisors, and licensed physical therapists. And those supervisors can be in healthcare or outside of healthcare. We see a broad range. You need to have those letters in a timely manner. And so your application will not be verified by PT-CAS until all the materials are received, and that includes your letters of recommendation. So it's your best interest to contact those people writing your letters early on in the process to make sure that they get in on time so that your application is not delayed and will be eligible for review. So let's talk about what that application process looks like this coming year. On June 16th, PT-CAS, which is the Physical Therapy Centralized Application Service, will open up for the coming year. On October 1st, that application process will close. You need to have completed all of your materials, and then PT-CAS will go through the verification process, and your application will need to be verified no later than November 8th, 2025. We send out our interview invitations usually in the middle of December, and then our interview process, it is all online, all Zoom interviews, and those will take place January 13th through 15th of 2026. So those timing considerations with PT-CAS. Sometimes PT-CAS verifies applications very quickly, but sometimes it can take 4 to 6 weeks for them to verify an application, which is why we really encourage you to get that application in. We recommend no later than mid-September to make sure that any problems can be addressed in a timely manner. And again, if your application has not been verified through PT-CAS by early November, it may not be reviewed. And we do not have a rolling or early decision process for our school. So with that PT-CAS, to apply for our school, you're going to go to ptcas.org and complete the single application for the University of Colorado. In this application, as Laura indicated earlier, you will indicate if you're applying to only one pathway or if you have a priority for one, but would like to be considered both. I would just like to say that if you are only interested in the residential program, then only say you're interested in the residential program. Our feelings are not hurt if hybrid learning is not something you're interested in. The same with hybrid learning. If you're like, I want to be on that hybrid pathway and I don't have an interest in residential, then please, by all means, let us know that. There is no secret sauce that if you pick both, it's going to change things. We're looking at you, the holistic person. So please indicate the path that you, or paths that you are genuinely interested in belonging to. The current prices for PT-CAS applications are $170 to apply for the first program and then $70 for each additional program. They have not released whether there is going to be a change to their cost for this coming application cycle, but we will update information on our website if that becomes available to us. All documents, all letters of reference, all transcripts are submitted through PT-CAS. They are not sent to CU. So please remember that everything needs to go through the PT-CAS system. Again, all official transcripts to PT-CAS, including dual credit coursework completed in high school. So if you did a program like concurrent enrollment, running start, whatever it may have been called in your district or state, those high school transcripts will need to be requested and sent in as well if they were from a junior college, a community college, a four-year college. Those references, the reference forms, my favorite part about the reference forms is that if your reference checks a box as they complete it, it will say that they can use that you can use that reference for all programs. And then your reference only needs to complete the form and submit a letter a single time for all the programs that you are applying to. So make sure you have that conversation with the people who are writing recommendations for you. We do have a supplemental fee. There is no additional application, just a supplemental fee. It's $25 for our school. The website will be linked through PT-CAS. That is in addition to the PT-CAS primary fee, and it's payable directly to the University of Colorado through our online portal. When we invite folks for interviews, the interviews are by invitation only, and our interview process is entirely done over Zoom. Each person who interviews with us will have 2 interviews. Those will be one-on-one interviews with different faculty or clinical partners. And again, that will take place in January 13th through 15th of 2026 for this coming cycle. Some facts about our incoming classes. We're still sort of in the middle of our 2024-25 cycle right now. This year we had 1,285 applications submitted. We invited 396 to interview. Last year we had 1,271 and we matriculated 71 in our residential cohort and 35 in our hybrid cohort. And that means how many students we had on day 1. So if you have case-specific questions that you would like to ask or talk more about the application process with us, please reach out to our admissions team, pt.admissions@cuanschutz.edu. The QR code will take you there. We're happy to answer any case-specific questions you may have. And with that, we will ask for any questions.